We will now start the press conference of the Prime Minister Suga. First, the Prime Minister will make remarks. Then, Prime Minister, the floor is yours. This month, on 3rd, Shizuoka Prefecture, in Atami City, the mudslide occurred, and so far, 9 people's deaths have been confirmed, so the serious damage has occurred. And in various areas in Japan, the damages are occurring. For those who passed away, I sincerely extend my condolences, and for those who are suffering the damages, I send my heartfelt empathy. And in Atami City, more than 20 people are still missing. And police, firefighters, and the Coast Guard and the SDF, more than 2,000 staff, they are engaged in serious rescue and search and rescue operation. The prompt rescue and support to those who are affected by the disaster, we will put an utmost effort. Earlier today, we held the novel coronavirus response headquarters meeting, and we decided to declare state of emergency to Tokyo Metropolitan City, and Okinawa state of emergency will be extended, and the period will be until up to 22nd of August. Priority measures: Saitama, Chiba, Kanagawa, and Osaka prefectures. Up until August 22nd, the priority measures will be extended. Hokkaido, Aichi, Kyoto, Hyogo, and Fukuoka prefectures. As of 12th of July, the priority measures will be lifted. Since early April, we have been taking these measures, and in the meantime, the vaccinations has made a significant progress in many areas of Japan. New cases continue to decline. The number of serious patients also decreased, and the medical front lines, as we hear from them, that their burden is easing, and to those healthcare professionals and the medical staffs, I sincerely appreciate your effort. Unfortunately, in the metropolitan area, the number of new cases still are on the rise, and one of the drivers is the high flow of people, traffic of people, and the Delta strain, the variants, which has a 1.5 times of infectivity than the Alpha strain. And the Delta strain, rapid expansion is our concern. On the other hand, for the infection situation, there is a clear changes or differences from the past. In Tokyo, those who have a higher risk of the critically ill, the elderlies, the vaccination ratio has reached 70%, and at one time, it exceeded 20%. For the elderly ratio of the total new cases have come down to less than 5%, and with that, the bed for the critically ill patients, it is trending at 30%. Therefore, the number of serious cases and hospital bed utilization ratio are trending at low numbers. However, the expansion of infections in Tokyo may expand to local areas, rural areas. During Obon holiday, summer vacation holidays, we can forecast many people want to travel. With the promotion of vaccinations, Now we have clear signs of a hope for the battle of the novel coronavirus, and we cannot, and we have to avoid another resurgence of a nationwide infection increase starting from Tokyo. So we are taking the preemptive steps. And that's why we decided to declare state of emergency in a Tokyo metropolitan city. It is until August 22nd, and the effect of vaccinations will be more evident. And if there is an improvement of hospital bed utilization ratio, it can be lifted before the time.
Since the lifting of the previous state of emergency within 3 weeks, the declaration was made, and we have been causing a lot of burden on many people around Japan, and I feel this is quite painful. However, after overcoming this period, I'm sure we have to be determined to be able to normalize our life. Specifically, Tokyo, Okinawa, in these areas, eating and drinking risks of infection have to be contained once again. So within bars and restaurants, the alcohol serving will be suspended across the board. And about the quasi-state of emergency areas or priority areas, the alcohol serving will be basically stopped. And depending on the infection status of each region, there will be a judgment. And for bars and restaurants, there has been a delay in financial support for shorter working hours. So shorter working hours. So there are some bars and restaurants who cannot cooperate. For many drinking and eating establishments, providing or offering alcohol is becoming life or death matter for many of their management. So we have to make sure there is no such a financial problem. So simplified screening should be done for providing such money and financial support, and for cooperating bars and restaurants, the cooperative fund should be provided upfront. That will be enabled. At the same time, in each prefecture, bars and restaurants patrol will be expanded so that we can be more effective in our countermeasures. Alcohol involved drinking and eating. So there are many occasions where people speak loudly without wearing a mask, and I feel very sorry for causing this trouble to bars and restaurants. But once again, I'd like to ask your cooperation. In Tokyo, those in their 20s to 50s, new infections are now spreading. In 40s and 50s, there are more people with severe symptoms. In family and inside of the workplace, there have been evident infections, 3 C's, and wearing a mask, and anti-infection measures, washing hands have to be exercised, and especially when you are conversing, I'd like people to wear a mask, for sure. Across Japan, across different parts of Japan, there has been an accelerated vaccination program and rolling out. And because of HCPs and the local municipalities, we are ahead of the curve in terms of the vaccination program. Per week, 9 million doses has been administered or more. And after full launch of the vaccination within 2 months, on a cumulative basis, 54 million has been surpassed already. The elderly, 72% of the elderly, and across Japan, 27% of the people in Japan has been vaccinated already once. And the countries where vaccination program was speedily done. So once 40% of the population get vaccinated, there's an evident decline of the new infections, according to what some say. So as things stand now, at the end of this month, the elderly who decide to be vaccinated will complete twice vaccination, and the people who get vaccinated once will reach 40% of the entire population. On the other hand, so more than expected, there has been an acceleration of the vaccination program, and from some local municipalities, there has been a voice calling and talking about the shortage. And in local municipalities, by the end of last month, 90 million doses of Pfizer vaccination has been allocated in the proportion to population, out of which 40 million is unused and went into stock. That's our estimation. Between July and September each month, 25 million doses will be allocated.
So adding the stocks, these vaccines will be utilized, and with that, about 1.2 million doses can be inoculated per day. And starting from next month, at the municipalities making a progress of a vaccination, we are going to increase. That's going to be the review we are going to conduct. And also by showing those reviews, the smooth inoculation will become possible. In addition, the Moderna's vaccine so far, 24 million doses have been secured, and up until September, 36 million doses will be added. We will use that through the companies and universities. Until last week, 2 million inoculations were made. And the applications we accepted will be reviewed promptly, and we are going to make prompt actions for those applications. To many people, we caused a lot of anxieties, but like this, until September, for those who want to be vaccinated, they will be vaccinated. 220 million doses have already been secured. So we are going to make sure it will be smoothly and promptly inoculated. And it is 2 weeks up until Olympic Games. It is going to be very unusual circumstance. The athletes from overseas and the stakeholders are arriving. And before the entry, 2 tests. And at the immigration. And also after the immigration, the athletes are being tested every day so that inflow of the virus to Japan is prevented. Many athletes have already been vaccinated. And at the hotels and accommodations, the pre-submitted activity and itinerary is confirmed so that there will be no contact with the Japanese people. For Tokyo Games, so far, if state of emergency is declared, no spectator may be a choice. That's what I have said. And the organizing committee, Tokyo Metropolitan Government, and IOC at the 5-party meeting, the handling, the decision regarding the spectators will be made. More 4 billion people over the world will watch the games on TV for the Olympic and Paralympic Games. It has a power to unite everyone's mind. The novel coronavirus, this is a serious challenge, and because of this particular time, the world can be united as one, and the humanity's efforts and wisdom. Through that, we can overcome this difficulty. That's the message we want to send from Japan, Tokyo. And for the first time, we are going to hold the Paralympic for 2 times as a city. And the regardless of age and the difficulties for the society and the world with a harmony. The mental barrier-free spirit is what we like to communicate to the world, and there are a lot of restrictions to these games, and it's going to be different from past games. That's why we need to realize these safe and secure games, and for the future generation and children, we will give hope and dream, and this will be a historic event. Since last year, we have been taking measures, and one step back and one step front. And at each time, we have been putting a lot of inconveniences to the people. And with the unprecedented enemy, this battle, there's no time for me to feel at ease. However, with vaccines, even the variants, the onset or the aggravation can be prevented. And medical drug development is also making progress. What we do right now is to contain the infections, and as early as possible, we help everyone to be vaccinated. And with these measures, we are going to put the period on the battle versus the COVID-19, and we can restore our peaceful daily lives. And I sincerely ask for your understanding and cooperations.
Now, from now on, we'd like to take questions from the floor. Dr. Omi, please come to the designated spot, and depending on the nature of a question, Mr. Omi, Dr. Omi will give us an answer. And if you are nominated, then please come to the stand microphone and state your names and affiliation and ask your question one by one. First, from a leading media outlet, Hokkaido newspaper, Sato-san. Hokkaido newspaper, my name is Sato. I have a question for Prime Minister. Tokyo will experience the fourth state of emergency. The state of emergency and priority measures have not been lifted for 3 months now. And each time you have been talking about containment of the virus, however, it was never fulfilled. So for how long people have to go through this experience, and there has been some distrust and exhaustion, and there has been belated measures, and probably the contents of the measures were not enough. And how do you see your responsibility and what's happening? And with repeated declarations, I think the efficacy effect of the measures are losing its momentum. Do you think this is enough? And do you think this is going to be the last declaration? And when can we regain our normal life? What is your projection? Can you communicate such a message to everyone? First, after the start of this year, twice the state of emergency was issued, and each time the number of infections and bed occupancy are taken into account for exercising a decision, and around the bars and restaurants and eating occasions, we try to stay focused on our measures for containment at an early juncture. So that was the whole purpose. And with people of Japan, establishments and businesses, we have been causing a lot of trouble, and we are asking their cooperation, and I would like to appreciate their cooperation. We have a one step forward and one step backward, and we need to break away from this situation, and vaccination is a key. By the end of July, 65 or older generation who desire to be vaccinated should be able to complete the program for the vaccination twice across Japan. When you look at what's happening around the world, and around the countries, there are many lockdowns which are far more severe than Japan, and with penalties and others, there have been rigorous measures, and there has been a repeat of the same situation. In this regard, by receiving some vaccination, people can regain the normal life that they used to enjoy. So therefore, the Tokyo new infections right now are ramping up and increasing. So the elderly, so it is very clear that there is a less infection and there is a severe symptoms because of the vaccination program rolling out, and we have to contain the infection spreading from Tokyo to other areas. It was quite a painful decision. However, we have decided to declare state of emergency this time. So with the acceleration of the vaccination program, until we see efficacy, this is going to be a measure until we can contain the explosive expansion around 40% of the entire population around the world. And once you have such a ratio attained, there is a declining trend for infections, which is evident. So daily lives have to be regained. With that in mind, the earliest possible achievement of 40%, I think it is quite important. By the end of July, we'd like to shoot for this achievement.
追加のご質問は
Please refrain from asking additional questions. Well, all the time, I myself, so far, we have been staging these anti-infection measures, and the vaccination is the first ever. And because of this vaccination program, there are some countries which are regaining their normal lives. So therefore, we attach the first priority to vaccination administration. And by having such, we will have a big change. I have a strong belief in this program.
よろしいですか。
Dr. Omi? This time, the government of Japan declaring a state of emergency for Tokyo, such a inquiry was given to our subcommittee, and we agreed. There is a background, and there are 4 components. Number 1 is in July, August, for the next couple of months, 1 month or 2 months, we have been implementing our anti-COVID measures for 1.5 years, and the most important peak, I think, is going to be this period. So that's number 1. And to Prime Minister's point, currently highly effective Delta variant is now replacing the traditional one steadily. And now vaccination turns out to be effective around the elderly and others. But one thing that I can say, there is one concern, the reason that we have to declare the state of emergency. There is a big reason, which is aggravation of the elderly is now being somehow contained because of the efficacy of vaccination. However, because of the Delta variant, those in their 40s and 50s, young generations, relatively young ones, are having aggravation. They are also being hospitalized and on artificial ventilators, and we have never seen such a phenomenon in the 3rd wave, 4th wave. So therefore, to Prime Minister's point, I'm hoping that this is going to be the last declaration. We never know what happens, but because of the acceleration of the vaccination program, and during 1 and 2 months, those in their 40s and 50s who are hospitalized and who are worsening at an accelerated pace. So therefore, during this period, we'd like to make sure to avoid the situation of the medical strain, because as things stand now, there is a high likelihood of having such a situation. So regarding the government decision or suggestion, so unanimously, we agreed.
続きまして
Then next question, Sankei newspaper, please. Sankei newspaper, I am Sugimoto. Tokyo Olympic Paralympic Games is my question. The Prime Minister, so far, if the state of emergency is declared, the non-spectator may become a choice. That's what you have said. The world can be united as one through the effort and the wisdom of humanity. The difficulty can be overcome. And even if with no spectators, do you see a significance of the games? And in 7 months, in February next year, in Beijing, China, the Winter Olympics will be held, and Chinese government, the political system probably will use those games as to advertise or politicize the event. That Chinese political system has made a victory through this crisis. And what is your take on that? First, the significance of Tokyo Games. First, amid COVID-19, safe and secure games are actually held and realized as we face the difficulty. Everyone's power is united as one to overcome this difficulty, and this is very opportune timing to address such a message in the Paralympics. 1964 Tokyo Olympics. For the first time in the history, Paralympic Games, the name of a Paralympic itself was used for the first time in a Tokyo 1964 Tokyo Games. So it was a very historic moment, and the people with disabilities in that games. There was a big turning point for those people with disabilities that they can participate and they can be proactive and play active role in the society. So people with or without disability and people, seniors and young people can help each other in a society with harmony in order to realize the society in the harmony. So it's really realizing the barrier-free mindset in the society, and I think it's very meaningful and important. And this Tokyo Games this time, the treatment will be discussed and decided by 5-party meetings, and 4 billion people over the world will watch the Paralympic and Olympic Games on TV. So in that sense, this event can be conveyed, broadcasted all over the world. It's the greatest opportunity. G7 summit meeting held recently. In the statement, it is articulated because it is Japan. Because it is held in Japan, the Olympic and Paralympic Games can be held. That was an intent articulated in the G7 statement. So in that sense, we are meeting all the expectation of the foreign nations.
それでは
Now, from now on, we'd like to take questions from other media outlets. If you would like to ask your questions, then please raise your hand. We will nominate who can ask a question and proceed to the microphone. And we'd like to take as many questions as possible from as many people as possible. So please try to make your question simple. Short sentences. Yamazaki-san of Nippon TV. Nihon TV, my name is Yamazaki. There was a mention about the Tokyo Olympic and the Paralympic Games, and it's going to be an unprecedented one and to be held under the state of emergency. Last time around, in a press conference about the Tokyo Games, having a protection of the people of Japan and the safety and their security, it's a responsibility of Prime Minister, you said. However, if we have a ramping up of the infections, then how do you see your responsibility? How do you see the situation? First of all, about the state of emergency. Under the state of emergency, we will be having the games. And amid such circumstances, this time, as part of the state of emergency, we had our big achievements with alcohol-related suspension. Bars and restaurants not serving alcohol. So that was the areas of the big achievement with regards to the containment of the spread of COVID-19. Against this backdrop, under state of emergency, of course, alcohol will be stopped. Priority measures. Areas in each local municipality in 4 prefectures apart from Tokyo, there will be the application of such. And so safety and security on this front, including anti-COVID spread measures, different measures will be staged, and the foot traffic is expected to increase. However, traffic measures and control and telecommuting had been thoroughly implemented since some time ago, and that way we will be able to deliver a safe game.
でそれで
新潟日報、横山さん please. 横山 from 新潟日報. COVID-19 vaccine supply from the government. The Pfizer vaccine supply is not secured, cannot be forecasted, so there is temporary suspension of the vaccination in the municipality of Niigata Prefecture. There are some sharp criticism about the lack of an accuracy in forecasting or securing the supply of the vaccination. You have said that you want to promptly make a progress on the vaccination. And what is your straightforward impression about what you have been observing so far? And many municipalities are anxious to receive an update of a supply schedule. For those who want to be vaccinated, at earliest possible, they should be vaccinated. And across Japan, the vaccinations are being accelerated, and it is the fastest speed it is being observed. And as the pace is exceeding what it was forecasted, and some municipalities are feeling very uneasy and anxious that they are seeing a short supply. And 90 million doses of Pfizer vaccines by end of June. In a population rated base, it was allocated. And in June timing, inoculation exceeded 50 million, and other doses of 40 million worth of doses. They do exist in the municipalities, but the vaccine need to be administered twice. And there are different situations or conditions that they need to receive 2 times worth of doses in order to start the inoculation. And we clarified the supply schedule, delivery schedule, and from August, those areas making progress, the weighted supply will be realized so that there will be no confusion. However, thanks to your cooperation, daily 1.2 or 1.3 million inoculations are being realized. I truly appreciate your strong cooperation.
はい、
Yes. ドワンゴ七尾さん。Thank you very much. Now I'm able to participate through lottery process, and sorry about the long question. The artists were looking for Look in Japan Festival 2021, so it has to be cancelled now. And the fourth state of emergency events and school trips and all others will be cancelled. So the organizers and the participants need to minimize and have been minimizing the infection risks, and why only the Olympics are only tolerated. How do you respond to such a candid question? Last year, 100,000 yen cash handout was delivered. Mentally and financially, people have been struggling, and last time around, 13 trillion yen was expended last time around. However, non-executed 30 trillion yen is remaining. How do you see the possibility of giving another cash handout to the people of Japan? Regarding the events, the outdoor festivals, as for the outdoor festival, so this is the largest one, and it was expected to happen by many people around, especially young people. I feel this is very regrettable. However, regarding the restrictions around events about Tokyo and the Paralympic Games, we have the same threshold, and under the state of emergency, after 9 p.m. without spectator, the events have to be held after 9 p.m. Regarding this point, I'd like everyone to understand this point. So, from now on, what kind of system will be put into place for holding the Tokyo Games? So that will be talked about among the 5 parties. But I myself, if when the state of emergency is declared, no spectator option will be allowed. And among the 5 bodies, there will be the discussion about the format of the game. At any rate, the containment of the virus and the vaccination have to be done with all-out efforts so that we can regain our normal lives. So my responsibility is to work flat out towards this goal. 100,000 yen cash handout. Regarding this matter, under COVID-19, there has been a lot of impact on people. And for those people, various financial assistance, labor costs, and the cash management help, and job adjustment funds, and various measures are being provided for people financially struggling. So this is a matter of course as a Japanese government measure. So that's what we are doing. And because of COVID-19, there are many people who are afflicted. So therefore, with this, we'd like to provide, and we are providing assistance.
はい、
Nikkei Shigeta-san, please. Nikkei, I am Shigeta. Regarding economic measures, this time the period is 6 weeks, so it is a long period. And the cares and attention to economy is necessary. And in summer, the economic policy framework should be established, and before end of the month, do you have a plan to submit the package? And what are the necessary measures to the companies and the household who suffered from the COVID impact? First, for those who are affected by COVID-19, we need to support them, which is our utmost priority, including financial support and labor adjustment subsidy, and also eating and drinking establishment support. In a Japanese economy, last year, tax revenue highest. It was at the highest level, and current fiscal year growth rate is forecasted at 3.7%, which is a simulation. And within this fiscal year, in a GDP, we are going to surpass the pre-COVID level. And by accelerating vaccinations, there will be a positive impact to the economy. And against the backdrop, the COVID-19 impacts on people's daily lives, we are going to pay due attentions. And the resilient, stronger economy is our target. So the strong economy to be established and to sustain the strong nation. The economic situation, we continue to check and be flexible in addressing any actions or measures. So in that sense, I have economic packages and measures in mind.
はい、
Next, moving on to NHK, Osanai-san. Osanai with NHK. About the Tokyo Assembly election, there have been many opinions raised from the LDP. And until the general election, are you going to reshuffle the cabinet? Within the LDP, there are many voices that we hear. The first priority is how to contain COVID-19. That has been the first priority, COVID-19 measures. At the same time, my tenure as the president of the LDP and the tenure as a lower house member as a politician will come very soon. So therefore, the term will be expired. So therefore, with everything in mind, I'd like to work.
はい、それでは再び
Sushiro-san from Trivia News, please. Thank you very much for the opportunity. Indonesia, Trivia News, my name is Sushiro. From 6th this month, new border control related new measures has been approved for Indonesia. 10 days of quarantine is necessary. This law, does it include Olympic VIPs, Olympic stakeholders? Are they also in the scope of this new border control? And VIPs, from how many countries are you going to receive the VIPs? From overseas, the athletes and game stakeholders, 2 times of test and before the immigration and a test at the immigration, and after immigration, daily test is conducted, and for the athletes. And Delta strain, due to the rampant situation of a Delta strain, to those who are coming from particular countries, like you mentioned, they are requested to take tests. So games-related people, 7 days before the entry, and then for 3 days after entry, they need to be quarantined and tested. Those are the new rules introduced, and this stringent measures is requested and conducted, and we are applying different rules for the games personnel. We will continue this safe and secure border control measures.
The Japan Times, Sugiyama-san. The Japan Times, Sugiyama. My question is for Prime Minister. The South Korean President Moon Jae-in will be coming to Japan on the sidelines of the Olympics. Would you like to have a summit meeting with Mr. Moon? Are you going to put any conditions for holding such a summit meeting, if any? First of all, for the opening ceremony, about the attendees from South Korea, no decision was made. That's my understanding. And having said that, currently, Japan ROK relations over a wartime labor issue and comfort women issue, the relations are very strained. And the bilateral relations and the pending issues have to be addressed, and with the responsible behavior and action taken by South Korea. So we'd like to continue to call on South Korea to take adequate actions in a strong manner. There's no change about our posture, but if Mr. Moon coming to Japan, in terms of diplomacy, of course, we have to provide cordial treatment.
それでは共同通信
Yoshida-san, Kyoto Press, please. This is Yoshida from Kyoto. I have a different question on the Tokyo Olympic and Paralympic Games. You said that you expressed a determination to have a successful, safe and secure Tokyo Games. And what are the criteria or the conditions to make the games and events as successful? For the secure and safe games, the stakeholders and athletes' thorough testings and activity management and control will be conducted so that the inflow of the virus can be prevented to Japan, and for the athletes to participate in with a peace of mind, the domestic, and there will be no any mutual impact for the infection situation to Japan, inside Japan, and to the Olympic community. And we have to thoroughly prevent any risk of increasing infection. And more than 1 year ago, at the Metropolitan Expressway, traffic fee raised by 1,000 yen, and traffic control and vessels. During the Olympic period, the port arrival of the vessels and remote work during the Olympic period, we have been making those various preparations so that traffic can be controlled, and the flow of people during the games period, it will be quite lower than it is now. And in that environment, the virus did not break in to Japan, and infection to be prevented. Those are the critical conditions.
それでは
Now, Radio Japan, Ito-san. Excuse me, Radio Japan, my name is Ito. I have a question for Prime Minister. According to the document which was circulated, the vaccine program is now being accelerated in Tokyo. The elderlies are not having new infections very often, which is a representation of the efficacy. And this time, this state of emergency is declared for Tokyo, and especially the people below 65, the people in their 40s, 50s, and 30s. For those people, in each local municipalities, there has been secured vaccine. For example, there's a minister in charge of the vaccine, Mr. Connor, so he can probably take control of the vaccines. So that way, there is enough availability in some prefectures where not many people want to get vaccinated. So are you going to redistribute such vaccination stock to Tokyo or some other areas where there is a shortage? About vaccinations and the basic policies around this. So across the board or on an across the board basis, for people above 65, which tend to aggravate, should get the vaccination first. And based on Dr. Omi's and other experts' opinions, 65 or older getting both doses first. So this is a request with each prefecture. And 65 or older, the elderly, 71% of the people were able to be vaccinated once, and 40% of the elderly were able to get 2 administrations. We have 1,741 municipalities across Japan, and the elderly, by the end of July, they will be able to have a administration. So things are going well so far. So the elderly should be prioritized first. So the stock being redistributed from local area to Tokyo, and there has been some media report about this matter. But across the board, we'd like to prioritize the people above 65, and from Tokyo and from mega cities, there have been the spread of tends to be the spread of the COVID-19. So therefore, workplace vaccination or university vaccination program is something that we bear in mind, and we are actually implementing such a program. Now in Tokyo, the people below 64 are now getting tickets for vaccination one by one. So STFs, large vaccination sites are also receiving their applications, so people can come around to get vaccinated at such sites.
はい。
Shinohara-san from TV Tokyo, please. I am Shinohara from TV Tokyo. At the municipalities, the cancellations of the vaccine reservations are seen. So in Japan, the AstraZeneca vaccines, about the possibility of including AstraZeneca vaccine into a government vaccination program. It has been already approved but not being used yet for the emergency use of AstraZeneca vaccine at the Health Ministry Council, referring to overseas cases and the usage in Japan and the situation in Japan. It is being considered and discussed, and it hasn't reached conclusion yet. Experts are now discussing, and we are going to continue to watch the expert discussion. And until September, all citizens' vaccines with Pfizer and Moderna, 220 million inoculation worth of vaccines have been secured. So that's what we are going to use first. Against the backdrop, AstraZeneca, Health Ministry's Council, we would like to wait for its conclusion. I believe there are several conditions for that vaccine, and the deliberation will be made by referring to overseas situations.
それでは
Now we'd like to take the 2 last questions. 毎日ニュースペーパー小山さん。 Mainichi newspaper. My name is Koyama. About the number of spectators for the Olympics. Having listened to what was said about Tokyo, no spectator is going to be the option for you, Prime Minister, and for other prefectures. What is your take? And of course, in the five parties talks, there will be a decision. However, Prime Minister will be responsible for safety and security of the people of Japan. So people want to know your opinion. So would you be able to express your opinion on this or policies? Like I said before, once we have a state of emergency declaration, no spectator option will be the option or will be allowed. And regarding how to treat the capacity for the venue or the cap on spectators, there will be some discussion for direction. However, for state of emergency and priority measures, we have specific rules. And we need to follow the guideline or the rules to determine the cap. And about the state of emergency, we have 5,000 spectators or so. We have such a rule, and so based on that rule, decision will be exercised.
はい、それでは
Mr. Azhari from Arab News, please. The last week, there are natural disasters and like in disaster in Tami, and it was broadcasted outside of Japan. And the regional disasters and the infrastructure development. In going forward, what are the measures is the government going to take for the regional disaster and infrastructure development preparedness? Thank you. Recently, the natural disaster occurs frequently, and those disaster is getting more and more severe, and we are working on the resilience building in Japan. The river development and the soil management and infrastructure aging for the mitigation and the prevention of the disaster-related damages. We have been making stringent measures and progress for the revitalization of our regional areas, the tourism, agriculture. Those will be the central pillars to raise the income in rural areas. And we are going to make a concrete progress. Thank you. For those who are raising hands, I am very sorry, but please send one question via email. In a later date, we will respond to your email with the Prime Minister's answers. Thank you very much for your understanding and cooperation. With that, we conclude today's press conference with the Prime Minister. Thank you very much for your attendance.